This program was produced by and first broadcast on Radio Kidnappers, a volunteer-based community access station. For more information, go to www.radiokidnappers.org.nz. Thanks to New Zealand On Air for making this program available through funding the Access Internet Radio project.
You're listening to Radio Kidnappers, the voice of Hawke's Bay. This is the program called Acupuncture on Air, and it's our pleasure, as always, to have on the hot seat Heiko from the Acupuncture Clinic in Hastings. How you going, Heiko?
I'm very good, Ken, and I'm actually feeling very good today because I'm off to Wellington after this for my annual acupuncture conference down in Wellington. So lots of cups of coffee and
a bit of R&R?
A bit of R&R and a little bit of pretending to listen to the speakers that I'm there to get my continuing education hours. I'm sure you're used to that, Michael. I just want to introduce everybody to Michael, who's on air at the moment from live from the United States. How are you, Michael? Do you want to just tell us a bit, Michael, where you're from and your background to acupuncture and so forth?
Sure. Yeah, well, these days I live in the very dang middle of the United States, St. Louis, Missouri. I've been here for about 9 years. I came here actually from Beijing.
Okay.
There was an opportunity to walk in and take over a clinic, and I just did that. So I've been here. I treat people with acupuncture and herbs, and bring a little bit of Chinese culture to the Midwest, the United States.
Now, we're going to talk today about acupuncture for the treatment of mental, emotional states. Geez, I could use some of that. But I wonder, before we get there, Michael, what drew you to acupuncture in the first place? I mean, why didn't you want to be a lawyer or a dentist or a movie star?
Well, I'll tell you, the funny thing is, I never wanted anything to do with medicine. In fact, from a young age, I wanted to keep myself as far away from medicine as I could. And what happened was I had some health issues of my own, maybe 30 years ago at this point. And a friend of mine insisted I get acupuncture, and I resisted until I finally gave in. I found that it helped me. And in fact, it dramatically helped me. And I started getting interested in it. And one thing led to another, and now I've been at it for 20 years.
Did you find that you resisted because you thought it was a bit like voodoo, and that's what most people think about acupuncture?
You know, people have different ideas about acupuncture. I think when I started it 20 years ago, they thought it was more voodoo, but, these days it's pretty much in the mainstream culture, even in a place as conservative as the American Midwest. Everybody's heard of it, and most people know someone who's had it.
Yeah,
it's not that weird anymore.
I'm finding it's quite similar in New Zealand as well and also Australia, but there's still like a large split. You have, including doctors, including people, that believe in it or at least have heard positive results about it, and then you have like the other, even if they've heard anything good about it, it's still nonsense. It's still, it's only going to work because it's in your head or something like that.
Yeah. You've been doing it for 20 years, Michael. Well, what's the biggest change you've seen in acupuncture in America in the last 20 years?
Actually, I want to come back to that quick thing about people think it might be in your head. Here's the thing. The head, our mentality, and our body, absolutely interconnected. You cannot divide them. And so when people say, is it just in my head, they're actually saying, I feel something in my body, but it's hard to believe that I can feel so different so quickly.
Now, today we're going to talk about...
Heiko, have you found that to be true?
I find one of the interesting scenarios that I have is I'll often will get a partner, and normally it's the female pushing their male partner to come to have treatment because they're sick of hearing him nag about something. And so he's come along and he doesn't believe in acupuncture, he doesn't want acupuncture. And I sort of say, what can I do for... Well, I'm just coming because my girlfriend told me to come. So I'm going to have 4 sessions to please her. Okay. So then I start treating, and then, it might be then after the third or the second session, and then he sort of says, I actually think this is working. I didn't think it would, but it is.
Right. Well, one of the things I encourage people to do is not believe in it. I don't ask anyone to believe in it. I simply ask them to bring their skeptical mind, bring a sense of curiosity, and see what happens. Judge by the results you get.
Now, in terms of Chinese medicine, and then we're looking at like the mental, emotional state, do you want to just tell us a little bit about, because people always ask, well, how does the liver affect the mind, or how does the heart, because the heart's in the middle of the chest, and and your mind's up in your brain. Like, do you want to just tell us a little bit about that?
I'd be happy to. So first of all, if you look at the Chinese character for heart, pronounced Xin, if you look at the Chinese character for heart, the character for heart means both heart and mind.
Ah, interesting.
So if you're in Asia and you're talking to a Chinese person and you say, "Where's your mind?" they will not point to their head. They will point to their heart.
And then with
so that's the first thing.
Yeah, go on, Michael, go on.
And then the second thing is, we tend to think of our emotions, and we think of our, for psychology, for lack of a better word, as being this sort of disembodied feeling sense that we go through life with. But the Chinese have looked at our emotions and our sort of mental life, if you will, as being attached to different organ systems. So, for example, the spleen, the digestive system, has to do with your thinking process. And isn't it interesting that when someone is in the process of making a decision, they're considering this, they're considering that, what do they say? They say, let me chew on that a little bit before I make a decision, right?
That's exactly right, yeah.
And then you've got the lungs, which are considered to be part of a sense of self-identity. The sense of will comes out of your kidneys. Your sense of being able to have appropriate boundaries in life, using things like anger, to be able to go, no, not for me, or yes, this is fine, or to have a vision of what you need. That all comes from the liver. And then that ability to connect in a heartfelt way with other people, of course, that comes from the heart. So with Chinese medicine, if someone comes in and they say, well, I'm depressed and, I can't seem to get anything done and, I don't know what I want, we would look at that person and go, maybe their liver is a little bit weak. And, we don't need to do psychotherapy with them. In fact, we don't do psychotherapy as acupuncturists. But we can work on organ systems that have an effect on mental, psychological, and emotional processes.
Does acupuncture work, Michael? You were talking about depression, but you've got people who are seriously mentally ill. I know lots of them myself. But there are also people who are psychotic. They're psychotic or they're schizophrenic. Would acupuncture help those who are very ill in their head?
It's a great question. And my answer is, I don't know. There are books that talk about how to treat that kind of thing. But in my practice, I don't see those kinds of people. And I've not gone into situations where I could try to bring Chinese medicine to help those kinds of people. And so I don't have any kind of clinical experience that would let me speak to that.
Some of the traditional acupuncture functions of the points, there's symptoms like, desire to take off your clothes and jump up on the table or running wildly in the streets and singing, some of these classic, and so, use this point for that. So, getting back to Ken's question, I do think definitely from a theory point of view, there is that potential to treat these serious mental things, but, I'm like you. I haven't had the very, very serious ones, but certainly the milder case, even people on medication, on lithium and on things like that, I've been able to treat, and then they've actually been able to either come off their drugs or change their drugs, or feel a lot better than what they were before. So, Ken, have you got another question you'd like to?
Yes, I just wonder if you could just maybe address that question I asked you a couple of seconds ago about treating psychotically ill. If we go back to the home of acupuncture in China, because Heiko tells me it's big time over there, how do they treat patients who are seriously psychiatrically ill over there? Do they use acupuncture in China, or do they revert to drugs and knock people out, that sort of thing?
Oh boy, that's a great question, and I have spent some time in China, but again, I didn't spend time in those kinds of clinics, and so I haven't seen for myself exactly what they do there. Now, I did have a teacher who would tell us stories. This is an old Beijing guy who'd been practicing acupuncture, oh my God, since the 60s. And he talked about times where they'd have like stark raving, crazy mad people come in. He'd say, there's this point under the tongue that you can needle, and it helps with mania.
Wow.
And that there was a time that he actually went and used that point. And he said it really helped to calm the guy down. And we said, do you know why? He goes, his tongue was pinned down. He couldn't talk. So, whether that's actually a point that actually calms his spirit, or it's just a way of, subduing somebody, in a big way. I mean, like, settle down, we mean business. It's hard to tell. But again, I think most Westerners that go and study in Asia, we're looking more to help sort of your garden variety, depression, anxiety, the various women's health issues, headaches, muscle pain, the kinds of things that we're usually going to be seeing in a Western practice.
Not a week goes by that Heiko doesn't say there's nothing that acupuncture can't help. Would you agree with him?
I think it depends on what you mean by help. I mean, sometimes people expect acupuncture is either voodoo, it's not going to do anything, it's all imaginary, or they expect an absolute miracle. And I think if you're looking for that absolute miracle, you're usually going to be disappointed. But if you're looking for something to shift, if you're looking to sort of walk a slightly different, or sometimes a dramatically different trajectory with your life, I think acupuncture, especially if you keep at it and you use it, can put you in a dramatically different place a few months and a few years down the road from where you were previously.
We've got a problem here in New Zealand where you can't really say that acupuncture is the bee's knees, because the traditional medical people will get on your back. Do you find the same over there, that you've got to be careful what you say, how good acupuncture is? Or is it part of the mainstream treatment?
That's a good question. I would say that I am circumspect with my words, mainly because I want to leave an open space for people to have their own experience. I don't want to suggest to them, you're going to have a particular experience. I want them to have their own experience with it. All that I ask of folks when they come for acupuncture is bring a skeptical, inquiring, and curious mind, and see what happens for yourself.
Are you allowed to say acupuncture works? Because, Heiko, you're probably not allowed to say that.
Yeah, they're getting really strict over here, and even things like on your advertising, where you certainly can't use words like acupuncture can cure something. And even now they're jumping up. Even now they're jumping up and down here. If we say, there's a research study that says that acupuncture treats back pain. Now they don't want to accept any research that's less than 5 years old. It's got to have been done with a certain number of people. We've got to, put the link to it. So they're getting really fussy over here. What about where you are?
Yeah, I would say it's not so fussy. Certainly not as strict as what you're experiencing there. I think we have to also be cautious about claims. So to say that acupuncture cures something, I think we need to be careful. Certainly you cannot make claims of cure to very, very serious disease. That'll certainly get you in trouble. Usually we say it treats or it helps. It can help alleviate. We usually speak that way.
Yeah, because we even have to...
in terms of research, I think we're allowed to talk about any research that comes out in any way that we'd like to, at least for the moment.
See, we've reached a point here where we're not allowed to say acupuncture can treat back pain. We have to say acupuncture may treat back pain. You know, so anyway, that's New Zealand.
Yeah, I don't think we have that. But I do know that when people call, they'll call and they'll say, well, acupuncture cure this, whatever they've got. And my response is always, well, it's a medical intervention, and like all medical interventions, your results will vary based on who you are, right? The same thing is true with pharmaceutical drugs. The same thing is true with surgery. The same thing is true with physical therapies, right? Everybody's going to be different.
And with that, I think we better wind up. And I usually finish off the show with a bit of a song. And seeing that you're from St. Louis there in the States, we're picking a song from St. Louis.
Here it is.
This program was produced by and first broadcast on Radio Kidnappers, a volunteer-based community access station. For more information, go to www.radiokidnappers.org.nz. Thanks to New Zealand On Air for making this program available through funding the Access Internet Radio Project.